So hello, good morning everybody. My name is Sarah Jane Marsh. I am the chair of the NHS England National Maternity Implementation Board. I am also the chief executive of Birmingham Children's Hospital and Birmingham Women's Hospital. I am exceptionally passionate about children's services. I believe that children absolutely deserve the very, very best start in life. They come into this world innocent, and it's absolutely our job as parents and as professionals to do the very, very best we can for them. And the more I've looked into this and the more I look at about how we get this right, the more I know this absolutely starts with maternity care. It starts with giving the mother the very best experience and the baby the very best opportunities in terms of both physical and mental health. And I think it would be a mistake to see better births as something that's just about those 9 months of pregnancy and the birth itself and perhaps the few weeks after. I truly believe that this is our opportunity to influence a generation, to make a massive difference for children in this country, not just now but into the future.
So my name's Lauren Hughes. I'm the Director of Clinical Policy and Operations in the Medical Directorate in NHS England. And I've also got the privilege of leading the Supporting Local Transformation workstream, which is part of the National Maternity Transformation Programme. And this programme is really set up to take forward the recommendations from Better Births, which is the report of the National Maternity Review. And really what we're trying to do is to support commissioners, providers, professionals right across the NHS to come together, to work together, to break down boundaries and to deliver the care that we know that women, their families and their babies want and need and ought to have available to them.
The NHS is one of the safest places in the world to give birth, and we have some of the best maternity services anywhere in the world. And we want all our maternity services to be as good as the best. And so we're pleased to be part of the NHS England Transforming Care Programme. The Secretary of State and the government have launched a programme, an ambition to reduce the number of adverse outcomes by 2030, so that we'll have 50% fewer maternal deaths, 50% fewer stillbirths, 50% fewer injuries to babies, 50% adverse outcomes overall, and that's very, very challenging ambition. And it means that we have to work across the whole of the maternity pathway from before conception all the way through and until after the baby is born.
My name is Bill Irish. I'm the postgraduate dean at Cambridge, working in health education east of England. My role in this project is to support workforce transformation and education, which is an exciting role as it cuts across a number of different work streams highlighted in the report. So what our overall aim is to identify different ways of training both midwives, obstetricians, GPs, psychiatrists, paediatricians, so that they can work much more closely together and work to deliver some of the intended outcomes from Julia's report.
Hi, my name is Simon Medcalf. I'm Head of Mental Health in NHS England, and I'm the workstream lead for the Perinatal Mental Health Programme. Our project on perinatal mental health is about expanding access particularly to specialist services for women who have mental health problems during the perinatal period. That's the period between conception and between the year after birth of their child. We know that actually mental health problems are pretty common for women during this period. Around about 20% of women will experience some sort of mental health problem, 10 to 15% might have postnatal depression, but there's also a range of much more severe mental health problems that women can have during this period of their lives. Against that backdrop, our project is about trying to expand the provision over the next 5 years to make sure that all women in all areas of the country are able to access specialist support when they need it closer to their home.
My name's Viv Bennett. I'm Chief Nurse at Public Health England and Senior Responsible Officer for Workstream 9 of the Maternity Transformation Programme, which is titled Improving Prevention. And the overarching aim of this workstream is to make sure that all women, every woman, can be fit for her pregnancy and fit during her pregnancy. So prevention is absolutely fundamental to maternity transformation. It really underpins the ambitions around safety. As we've said, individual factors need to be addressed, and some of the inequality issues we can make a difference. And indeed, around choice, we want women to be able to have a choice about their maternity care and their place of birth. And that depends on being in a position where your health allows you to make that a reality. So an awful lot of work about prevention across the whole maternity programme, with Workstream 9 actually acting as the champions for prevention and taking forward specific activities around evidence-based practice and services.
Hello, I'm James Sanderson and I'm the Director of Personalisation and Choice at NHS England. I'm responsible for the Maternity Pioneer Programme. The Maternity Pioneer Programme aims to support new ideas in this area to improve the choice that women have, to personalise the services much more effectively around their needs and develop more opportunities for them having the birth experience and maternity experience that they would wish to have. We're working with 7 maternity pioneers, which represent 36 CCGs, clinical commissioning groups, and they're working in clusters of areas in order to improve the choice that women have for maternity services, and also to look at new ways of supporting that choice.
Hello, I'm Matthew Jolly. I'm National Clinical Director for Women's Health and the Maternity Review, and I'm also the lead for the Data and Information workstream. We intend to create the most complete, comprehensive and accessible set of maternity data ever achieved in this country. We're also arranging for the maternity services data set to be updated annually so it remains fit for purpose. These data can then be linked with other data sets such as mental health and the neonatal data to create an even more powerful data set that can be used for our dashboards and also for the national perinatal audit in the future. As part of our work, we are going to develop a set of national indicators that will help us identify where there is unwarranted variation within maternity services.
At NHS Digital, our vision is an NHS paper-free at the point of care. We want to harness the potential technology and provide patients with the information, advice, treatment and access they need to make sure that they take a more active role in the management of their health and care needs. Our immediate priority at NHS Digital is to improve the delivery of maternity and child services in England. Earlier this year, the National Maternity Review report called for seamless sharing of maternity information across pre- and postnatal care. The review also recommended that mothers should take a much stronger role in the center of this process, and they should have much greater access to information about their pregnancy. We want every minute at every pregnancy appointment to be spent for the provision of care rather than having the clinician and the patient repeat the same basic information. Lastly, we want to make sure that healthcare professionals have access to the complete clinical history of their patients online so that they can enable better real-time decision-making and timely action.